Exclusive Moncloa, the healthcare budget will increase significantly for the president of the government, Pedro Sánchez. Let's begin. Hello everyone and welcome to a new edition of Precautionary Measures. They can't beat us, they won't beat us. First of all, really thank you all so much for your messages that I've received through every channel, by email, on Instagram, on Twitter. Anyway, really thank you all so much. I am completely overwhelmed by the support I've received in the last few hours by the audience for these two videos we've published about the state of health of Pedro Sánchez, about the illnesses he suffers from. Really, thank you all so much for all your support. And we're going to keep going, because that's what we're here for, to inform you, to tell you. All that information that the government of Pedro Sánchez wants to cover up wants us not to tell. And that's why we're suffering pressure and public attacks, even from some ministers of Pedro Sánchez. This video is going to be special. It's going to be an important video, really. Stay until the end because I'm going to reveal new exclusive information about Pedro Sánchez. I mean, it's going to be shocking. And also, we're going to talk about what happened today because so many things have happened. There were a lot of reactions yesterday to the venting I did in my video because honestly, it served as therapy. It's also my channel and I use it to connect with you, to tell you how I'm doing, how I feel, and also to vent. Hey, that's what my channel is for, right? If not, where else am I going to do it? I was telling you about the shameful behavior of many media outlets, and I also mentioned political parties that seemed like for both the Popular Party and Vox, this issue wasn't important. Pedro Sánchez has a cardiovascular injury, as we exclusively reported on Medidas Cautelares and Libertad Digital. Well, today we have news, today we have important news, and what's more, it comes to us directly from Congress, from the deputies. I'm going to show you a video of what happened this morning during the government's control session at the Congress of Deputies. Because finally, a politician, in this case a deputy from the Popular Party, Cayetana Álvarez de Toledo, has asked the Minister of Justice, Félix Bolaños, about the health status of Pedro Sánchez, after the exclusive report by Medidas Cautelares, Libertad Digital. And we're going to put it on the screen so you can listen to the question and the answer from Félix Bolaños. Don't miss it, we're going to show it big inside.
Video. Mr. Bolaños, that's why I'm going to ask you one last question. Does the president of the government have a health problem? They boast about transparency, so declassify his medical records.
Mr. Minister, when you're ready, please silence.
Thank you, Madam President. When you think that Mrs. Bolaños de Toledo has reached the limit of moral baseness, you realize there's always a step lower. You who have always wanted to be a grande of Spain, look at what you've become. As bait for the far-right vote, your party sends you to Aragon to see if you can get some ultra votes along with Vito Quiles. By the way, of course, you achieve the opposite. You mobilize the Vox vote, Vox gains seats, and you lose them. And your party still doesn't realize that, in fact, you are an electoral asset for the Spanish Socialist Workers' Party. I'll end by asking, what do you think about your friend Millei's labor reform, making workers do 12-hour days? Are you sure you support that? Thank you.
And let's analyze this video you just heard because I find it really funny. He acts all cocky. The Minister of Justice, Félix Bolaños, the Rasputin of Moncloa. But he denied the information. He accuses the PP Congresswoman Cayetana Álvarez de Toledo of having stooped very low, as he says. But he denied the information. Did you hear it? No, he hasn't denied the information. Not even the government itself denies the information revealed exclusively by Medidas Cautelares. Libertad Digital on Pedro Sánchez's cardiovascular injury. But the political news has also had other reactions that I think speak for themselves. And you have them right on the screen. There's no need to go any further. And it's the reaction of the Minister of Transport, Oscar Puente, popularly known by the people as Oscar Gutan because of his primate-like and simian manners and insultar a la gente, y of Oscar Gutan, because first he tried to be funny in a tweet about the exclusive information we revealed regarding precautionary measures on Libertad Digital. And he says in a tweet, which you can read right now, the usual spokesperson of DOGT, referring to the objective, the debacle, referring to the debate, Libertad Vegetal, referring to Libertad Digital, look how funny Minister Oscar Gutan is, Libertad Vegetal, how funny, what a wit. Wait, there's more, and get ready to laugh. Instead of the association has to oír, he says has to orin, says Oscar Puente in this tweet. Today he comes to Congress with the latest big scoop. It's related to the president's health. What do they have left? That's enough. That was the first part. But wait, it didn't end there. It didn't end there because Oscar Puente came back at it. He came back and wanted to make another attack because he thought it wasn't enough, right? Another Twitter user, Alberto Olmos, writes to him and says, Minister, what vulgarity, please? Do you know what the minister says? Oscar Gutan? I agree. Imagine acting all noble, of high lineage, and asking about someone's health. Basing it on the biggest crap in the digital scene. The biggest crap in the digital scene. Mr. Oscar Gutan, we're not going to use such crude terms as you do. There you are. Well, with the minister's portfolio, we're not even going to use pejorative terms, right? Man, Oscar Gutan is an affectionate nickname they have for you here in Spain. But man, to act like that, to speak in those terms, I mean, what a shameful minister we have. What a shameful minister of transport. What a shame. But you are right now removing the adamant tracks from the accident secretly and with malice from Adib, taking them away so that the justice system can't investigate. But what are you telling me about the biggest crap? No, the biggest crap we have is this government and ministers like you. But what are you saying? Anyway, I'm not going to waste any more time on this minister, if I can even call him that, because honestly, he doesn't live up to the title of minister. And now, let's continue with our own thing, with what we do, which is sharing. Because we have very important information, which I'm going to reveal next. Right now, in precautionary measures, we're on a really strong streak. I'm working hard to provide you with the best information. And we have new exclusive information in precautionary measures, which we're going to go over right now, so you have all the details. Because, of course, in the end, well, as they say, right? I mean, when it walks like a duck, has feathers and so on, and says quack, well, it's a duck. Well, today we're going to give more details that I think will complete the circle of information we've revealed about Pedro Sánchez this week. There you have Pedro Sánchez in a photo, posing there, not with his usual face, well, in Moncloa. I want to focus on Moncloa as it's important for what I'm about to say. Moncloa, the budget allocated to monitoring the health status of the President of the government, Pedro Sánchez, will increase significantly. Pay attention to what we're saying, as you know, precautionary measures and Libertad Digital. They exclusively reported that Pedro Sánchez has a cardiovascular condition and has been secretly receiving treatment for it in recent months. At the Ramon y Cajal Hospital, this healthcare center is the reference hospital for Moncloa, the Congress of Deputies, and the Senate, since there is an agreement signed for this purpose. The current heart condition has not been the only medical problem that the Prime Minister has had to face in recent times. However, those injuries have not had any significant clinical impact. I'm referring to what we revealed yesterday in precautionary measures, that he has also recovered from a prostate injury. We're not making this up, but if you want more details, I can make them up for you. Don't worry, you'll get more details. As we have learned in precautionary measures, Moncloa wants to significantly increase the healthcare budget allocated to the presidential complex to the Moncloa complex itself. This is part of the collaboration agreement between the government of Spain and the Community of Madrid, which guarantees healthcare assistance to the president, other high-ranking officials, and the staff of the Moncloa Palace. The current agreement expired in June 2025, and since then, negotiations have been underway to set the allocated budget, the number of medical personnel for this purpose, as well as the budget distribution for this item. And what about the Community of Madrid? That is, in this negotiation between Moncloa and the Community of Madrid, it has to be established. What is the annual healthcare budget for the Moncloa presidential complex, and how many doctors, specialists, and healthcare workers need to be assigned for this purpose? And also the distribution of the budget, because obviously it increases a lot. The entire Community of Madrid is not going to pay for it. Moncloa and the government of Spain will have to cover part of it. They tell us that the negotiation of this agreement has already been completed and that all that remains is for all the data about it to be published. In the official State Gazette and in the official Gazette of the Community of Madrid, it is not ruled out that this publication could take effect this very week. It's Wednesday, so it could be tomorrow, Thursday, or even Friday when that agreement will be published, with the updated data on the budget and the healthcare personnel assigned to this matter. It should be noted, as I mentioned the day before yesterday, that the president of the government is a very hypochondriac person, and he is obsessed with his health condition. Since he became president of the government, when he moved into La Moncloa, his wife Begoña Gómez demanded that the then chief of the medical staff always accompany her husband to all events and trips. And since then, Pedro Sánchez kept that doctor for himself. Well, the same sources we consulted point out that, aside from the president's cardiovascular disease, the budget and the number of healthcare workers will increase considerably due to the legion of advisors at Moncloa, which has continued to grow since Sánchez came to power. It's hard to keep track. With these numbers, I don't even know if we're already at 1,000 advisors, 900, 600. It's truly outrageous, an absolute madness, and as you know, all of us Spaniards pay for it with our taxes, right? So, the legion of advisors for Pedro Sánchez obviously also need to be able to receive medical treatment if there's any incident inside the complex, and that's why it also increases. That is, apart from Pedro Sánchez's illness, the number of advisors also keeps growing. The legion of advisors for Pedro Sánchez makes the budget increase even more. And just to remind you of the information we revealed exclusively, and that's why Oscar Gutan is insulting us, he's insulting us. The Minister of Justice tells Cayetana Álvarez de Toledo she has sunk very low. I'm waiting to see if Vox makes a statement. I've already posted the PP video, and I'll post Vox's if they respond. As I was telling you the day before yesterday, the Prime Minister's heart condition could lead to possible cardiovascular events, such as a thrombosis or a heart attack. And for that reason, he undergoes frequent checkups at the Ramón y Cajal Hospital and other private medical centers by specialists in his condition. I'm telling you that I have more information, I'm investigating it, and I have more information, and I'm not going to stop. During the checkups, diagnostic tests are performed to monitor his progress. One of the doctors who has monitored the president most closely is the head of the cardiology department at Ramón y Cajal, José Luis Zamorano, who is an authority not only in Spain but also at the European level in this field. I also told you in that exclusive report that the treatment of Pedro Sánchez at Ramón y Cajal Hospital has been carried out with the utmost discretion and confidentiality possible. In fact, the president would go to his checkups on days with fewer people and at odd hours so as not to be seen like on a Sunday. For example, at 7 in the morning, the president was received by 3 doctors and entered the hospital, which had been secured beforehand. He would go through the kitchen dock with his security detail to a service elevator to go up to the floor where he is treated. This is the information, and that's how things stand in precautionary measures and in digital freedom. We will continue moving forward, revealing all the information. It has been hard for us, but it seems that people are starting to realize that the information is truthful, that it is true, and we have to ask ourselves what is the state of health of the president of the government, because if he is not in full physical capacity, we will have to debate whether a series of mechanisms should be put in place so that he cannot continue as head of the government, whether it's him or someone else in the future. If a president of the government is not fully capable of continuing to lead the government, then all Spaniards need to know about it. Because depending on his state of health, he may make certain decisions or others, and that can harm the citizens. And that's why we've started this public debate, and that's why we're revealing this information, and that's why we'll keep revealing information. Where? Well, right here on the Medidas Cautelares channel. That's it for this edition of Medidas Cautelares. And well, as I told you before, I'm impressed by the great support we've had in the last 24 hours. I think we've gained more than 1,000 subscribers. We've surpassed 100 Medidas Cautelares members. Really, thank you all so much, and I don't want to leave anyone out. That's why we're going to dedicate today's show To all of you who have been supporting the channel since yesterday and who have become members and have also made financial contributions, each one with what they could. Really, I appreciate anything. Thank you so much. Everyone does what they can. And for me, that's what matters, because it means you trust me, and that's the most important thing for me. We have to say that we have 1, 2, 3, 4, 5 new members, like the chosen ones. Really, we've already surpassed 100 members. Thank you so much. Today's program is precisely for these 5 new members. One is named Litus, another Cristina Reigada, Roxy Tafona Conques, and Maria Luisa Sanabria. It's for you 5, the new members of Medidas Cautelares, and also for those who have made financial contributions via Bizum, each one with what they can. For me, always super generous. Thank you so much. Miguel Ángel Sánchez, María Julia López, Sara Cea, Francisco Sánchez, Dolores Quesada, María Inmaculada Pereo, José Antonio Alfonso, and Mari Carmen Roldán. Thank you all so much, because this community wouldn't make any sense without you. We wouldn't get anywhere. And this gives me the strength, the motivation to keep informing you and to keep sharing with you. All the information we receive, whether it affects the president of the government or anyone else, anyone at all, we will share it here on Medidas Cautelares. Why? Because, as I always say, the key is ensuring this information reaches everyone. Information is power. See you soon.